All right, you did it. You survived nursing school. But now there's one final challenge standing between you and that nursing license, the NCLEX. In this explainer, we're giving you the complete blueprint to not just pass this thing, but to absolutely conquer it. That's the million-dollar question, isn't it? The pressure can feel pretty intense, but trust me, it's totally manageable if you have the right game plan. We're going to walk you through everything. Building a bulletproof study schedule, mastering the mental game on test day, and even what to do after you finally click that submit button.
Okay, first things first. Let's get one thing straight. Preparing for the NCLEX is a marathon, not a sprint. Trying to cram everything in at the last minute? That's just a recipe for disaster. Real success is built on a solid foundation of consistent, structured prep. So what does this marathon actually look like? Well, a really effective study plan usually spans about 4 to 12 weeks. You'll start by taking an honest look at your weak spots, then dive deep into content review. After that, you pivot hard into tons of practice questions, and then you wrap it all up with a final review. You're basically building your knowledge methodically, brick by brick. Now, this is where the magic really happens. Doing somewhere between 300 to 1,200 practice questions every single week is, without a doubt, the most critical part of your prep. It's not just about the sheer volume, it's about building up that mental stamina. And more importantly, it's about training your brain to recognize the very specific way NCLEX questions are designed. And listen, every single wrong answer is a gift. It's an opportunity to figure out why you missed it and turn a weakness into a major strength.
So you've put in the hours, you've hit the books. Now, let's build your toolkit for the exam itself. See, knowing the material is one thing, but applying it correctly when you're under pressure, that's a whole different ballgame. These strategies are what's going to give you that edge.
The process of elimination is going to be your absolute best friend in there. First, read the entire question and every single option. Next, zero in on the keywords that are framing the whole scenario. Your main goal here is to immediately toss out the 2 answers that are just obviously wrong. And just like that, you've taken your chances from 25% to 50%. And speaking of keywords, these words right here are like giant flashing signs in the exam. They are not filler, they are direct commands. When you see first or initial, the question is demanding the very first thing a nurse should do. Best or priority is asking for the single most critical action. Spotting these words is the key to understanding what the question is really asking. Here's a huge tip. Be super suspicious of absolutes. I mean, think about it. In nursing, when is something always or never the case? Patient care is all about nuance. So an answer choice with a word like all or none is a major red flag. You want to look for the options that have more flexible words like usually or sometimes. They just reflect the reality of clinical practice way better. And finally, you have to trust your preparation. That little gut feeling you get, that's not a random guess. That's your brain, packed with all this knowledge, processing information at lightning speed. You have to resist that urge to second-guess yourself. Don't change an answer unless you have a crystal-clear aha moment that proves your first choice was wrong. Your initial, educated instinct? It's usually right on the money. Okay, so beyond all the strategies and the content, there's the inner game. Knowing the material is half the battle, for sure, but the other half is all mental. Mastering your mindset, managing that anxiety, and holding on to your confidence, that's just as vital as knowing your pharmacology. Honestly, it's often what separates a pass from a fail. You need to have these tools ready to go on exam day. When you feel that panic start to bubble up, use deep breathing to ground yourself. Visualize yourself sitting there, confidently answering questions. When a negative thought pops in your head, actively reframe it. And please, get a full night's sleep. Your brain's performance literally depends on it. Sooner or later, you're probably going to hear about something called the Pearson VUE Trick, or the PVT. It's this unofficial thing where people try to re-register for the exam to see if the system stops them. Let's be really clear, this is not sanctioned, it's not reliable, it's basically a glitch in a payment system, not some secret results portal. It can cause a ton of unnecessary stress or false hope. My advice, just ignore it and wait for the official results. We've covered the prep, we've covered the mindset. Now let's get down to the main event, exam day. Nailing the logistics is so important because it gets rid of all that last-minute stress and lets you focus all your brain power on the test itself. Think of this checklist as non-negotiable. You absolutely have to have a valid, unexpired government ID and your authorization to test, the ATT. But what you don't bring is just as important. No phones,
no watches, no study notes in the testing room. A simple mistake here could seriously jeopardize your whole exam. That marathon analogy? Yep, it applies on exam day too. You're going to be offered scheduled breaks. Take them. I don't care if you feel like you're in the zone. Use that time. Stand up, stretch, and give your brain a reset. It is not wasted time, it's a critical strategy to fight off mental fatigue and stay sharp. You click submit. The test is over. Let's talk about what comes next and how to get through this final stretch. The second you walk out of that testing center, your work is done. Your only job now is to disconnect. Don't go home and obsess over questions you think you might have missed. Don't look up answers. You have earned a real break. Go do something you love and celebrate the massive accomplishment of just finishing this thing.
So here's how the results actually work. Some states will offer an unofficial quick result service after about 48 hours, and you have to pay a fee for it. But remember, your official final result, the one that actually counts, that comes directly from your state's Board of Nursing. So you just have to be a little patient and wait for that official word.
Just take a second and let this sink in. You spent months preparing. You sat down and faced a high-stakes, incredibly challenging exam, and you saw it all the way through to the end. No matter what the outcome is, finishing this process is a huge achievement that says a lot about your dedication. And that brings us to the end. You have to remember, the NCLEX isn't really the finish line, it's the gateway. It's the key that unlocks the door to a really challenging but incredibly rewarding career. All that hard work was just to get that door open. So the real question is, with that license in your hand, what will be your first step in changing lives?